Hi, I'm here with Dr. Maggie Sibley at the CHADD conference in Chicago. Maggie, tell us about your session.
So I was just presenting on people with ADHD who are older, adolescents and young adults, and what clinicians need to know about figuring out whether or not they have ADHD.
So you brought up something in your session about the way these clinicians diagnose. Is there an issue that you see or something that might need to be done better?
Well, sometimes clinicians meet face-to-face with the person who may have ADHD and start talking to them, and it can be unclear whether that person has ADHD or not. And that's the problem, is figuring out, is the information that I just gained from this person enough for me to make that diagnosis?
So what problems can they be from just somebody who is just saying certain things? Because the way I tend to notice is if somebody's just coming in, could that easily be manipulated just so they get the drugs, or maybe they're just not communicating that well? What are some other issues you can see?
Those are the questions that a clinician should be thinking about. There are some people who might be trying to fake a diagnosis, but another thing that comes up and might get less attention is sometimes people may have ADHD and have a hard time articulating that they have certain symptoms. And so clinicians might miss diagnoses and say someone doesn't have it because they only listened to what that person had to say, and that person may not have had all the information that the clinician needs.
So what do you recommend for clinicians on how they can effectively diagnose?
What we recommend is that someone should find other people in that individual's life and get a picture from them of what they see. So that could be that person's parent. It could be a teacher that knows them well. It could be someone that person's close to, if it's an adult, like a roommate or a significant other. Because oftentimes it's hard to see a symptom in yourself that someone else might be able to see in you.
Interesting stuff. So basically get people who know this other person involved in some way. Just try to keep it under the insurance program. I think will be good. Well, Dr. Maggie Sibley, is there any way that people can find out more of what you do? Where can they go to check out your stuff?
Sure. I have a website for the lab that I have at Florida International University, and they can go to that website, which is stand, like stand up, .fiu.edu.
Hey, that's why I always love having graphics that go right below us. So for those people who have the sound download work. Well, Dr. Maggie Sibley, it's been a pleasure talking with you. Thank you.
Thank you. It was nice to meet you.
It was nice to meet me.